Welcome, everyone, to this weekly neurology deep dive.
Good to be here.
Today, we're tackling a recent meta-analysis. It looks at cardioprotective glucose-lowering agents and their potential link to dementia risk for people with diabetes.
A really important topic.
Absolutely. And just before we jump in, a quick reminder. This deep dive is strictly for education. No commercial goals here, and it's really just a summary.
That's right. You really need to read the full paper for all the details.
Definitely. We'll be focusing on the data points most relevant for neurologists in, daily practice, keeping it practical, and we'll aim for under 15 minutes.
Okay. So we know diabetes is a risk factor for dementia. That's well established. But the role of specific diabetes treatments in, well, maybe preventing cognitive decline, that's been less clear.
So this study tried to shed some light.
Exactly. This meta-analysis aimed to see if certain glucose-lowering drugs, the ones known to protect the heart, SGLT2 inhibitors, GLP-1 receptor agonists, metformin, pioglitazone, if they're linked to a lower risk of dementia or cognitive issues compared to controls.
And did they look at specific dementia types?
Yes, that was a secondary goal, to see the effect on primary subtypes, like vascular dementia and Alzheimer's.
Got it. Where did the data come from?
They searched PubMed and Embase right up to July 11, 2024.
And the criteria for including studies?
Pretty strict. They only took randomized clinical trials, RCTs, comparing one of those cardioprotective therapies against a control.
Yeah, okay.
And crucially, the trials had to report either dementia incidents or changes in cognitive scores. Oh, and a minimum follow-up of 6 months.
And how did they define cardioprotective?
Good question. Defined as therapies recommended for reducing cardiovascular events based on, large phase 3 trials.
Makes sense. How many trials made the cut?
In the end, 26 RCTs were included. Quite a substantial number of participants, too. 164,531 people in total.
Oh. Okay.
The main outcome they looked for was dementia or cognitive impairment combined.
And secondary?
The dementia subtypes, vascular and Alzheimer's primarily, and also any changes reported in cognitive scores from specific tests.
What about the participants themselves? Average age? Gender split?
The mean age across the studies was 64.4 years, and women made up about 34.9% of the participants.
So the big question, what was the overall finding? Did these drugs, as a group, reduce dementia risk?
Well, here's the headline finding. When they pooled all these cardioprotective therapies together, there wasn't a statistically significant link to a reduction in overall cognitive impairment or dementia. The odds ratio came out at 0.83, but the 95% confidence interval was pretty wide, 0.60 to 1.14.
So because it crosses one, you can't be sure there's a real effect for the whole group.
Precisely. Suggests a trend, perhaps, but not statistically robust for the combined therapies based on this data.
But I imagine the story changes when you look at specific drug classes.
It does, quite significantly, actually. This is where it gets interesting. GLP-1 receptor agonists were associated with a statistically significant reduction in dementia.
Okay, what was the number there?
The odds ratio was 0.55, and the confidence interval was 0.35 to 0.86, so it doesn't cross one.
That seems noteworthy. A potential protective signal for GLP-1s.
It certainly stands out, but contrast that with the SGLT2 inhibitors. They showed no such effect.
Really?
Yeah, their odds ratio was 1.20, with a confidence interval from 0.67 up to 2.17.
So no reduction seen there. Maybe even a slight trend the other way, though not significant?
Correct. And the difference between the GLP-1s and SGLT2s was statistically significant. The p-value for that heterogeneity was 0.04.
Interesting difference. What about metformin and pioglitazone?
Well, that's another key point. They didn't actually find any metformin trials that reported dementia outcomes specifically.
Not at all.
Nope. And for pioglitazone, only one single trial was included in that overall dementia cognitive impairment analysis.
So very limited data for those two.
Extremely limited in this particular context of dementia outcomes.
Okay, let's move to the subtypes. What about vascular dementia?
For vascular dementia, again, looking at the overall group of therapies, no significant association was found. The odds ratio was 0.45, but the confidence interval just touched 1, 0.19 to 1.07. The follow-up was around 3 years, 35.7 months on average.
Were the event rates low?
Very low. Only 0.01% in the treatment groups versus 0.03% in controls.
And did that hold true for the specific classes, like SGLT2s and GLP-1s?
Yes, consistent picture there. The odds ratio for SGLT2s was 0.35, and for GLP-1s it was 0.38, but neither reached statistical significance, likely due to the low event numbers.
Okay, how about Alzheimer's disease?
Similar story for Alzheimer's, unfortunately. No significant association with the overall group of glucose-lowering therapies.
What were the numbers?
Odds ratio was 1.20, confidence interval 0.82 to 1.77, again crossing 1. This was over a slightly longer mean follow-up of 37.1 months.
And the event rate.
Also quite low, 0.09% in both the intervention and the control groups.
Was that consistent across the drug classes too?
It was. For SGLT2s, the OR was 1.99. For GLP-1s, it was 1.85. And for that single pioglitazone trial, 1.07. None statistically significant.
Any other dementia types mentioned? Lewy body.
Yeah.
FTD.
They looked at Lewy body dementia. Again, no significant reduction found. The OR was 0.58, but the confidence interval was very wide, 0.12 to 2.86.
Reflecting low numbers again, I assume?
Extremely low, 0.004% versus 0.01%. And for frontotemporal dementia, FTD, there just wasn't enough data. Only one trial reported on it at all.
Right. Finally, what about cognitive scores? Did the drugs impact test performance?
They did look at that, but the data was sparse. Only 3 trials reported changes in cognitive scores.
Which drugs and populations were those?
These trials involved exenatide, which is a GLP-1RA, and pioglitazone. They were tested against placebo, but in specific groups, patients with Parkinson's disease or people who'd had a stroke.
And the result?
Analyzing that limited data showed no significant differences in cognitive scores between the active drugs and placebo in those specific patient groups.
Okay, so it sounds like there's some important caveats here, limitations to this meta-analysis.
Absolutely critical to mention those. The authors themselves point out a major one. Most of these trials weren't designed to look for dementia in the first place.
So dementia was often just reported as an adverse event.
Exactly. Which means it was likely underreported. That could explain, or at least contribute to, the very low event rates we saw across the board.
That makes sense. Any other limitations?
Yes, the average age of participants, around 64, might be a bit young to see high rates of dementia onset, especially when combined with the relatively short follow-up periods in many trials.
Right, you need time for dementia to develop and be diagnosed.
Precisely. Both factors likely played a role in the low event counts.
So let's try and synthesize this for the practicing neurologist. What's the main takeaway?
I think the key message is, looking broadly at these cardioprotective diabetes drugs, this meta-analysis didn't find a significant reduction in overall dementia risk. However,
These are GLP-1s.
yes, however, there was that statistically significant signal suggesting GLP-1 receptor agonists might be associated with a lower risk of dementia.
While SGLT2 inhibitors and pioglitazone didn't show that same effect here, and metformin data was missing.
Correct. That's the nuanced picture emerging from this specific analysis.
And that GLP-1 finding, it suggests something beyond just heart or glucose benefits.
It potentially does. It hints, at a possible neuroprotective role for that specific class of drugs in people with diabetes. It's intriguing.
But clearly, more research is needed.
Definitely. This really highlights the need for large, well-designed RCTs that are specifically set up to track dementia and cognitive changes as primary outcomes.
And presumably with longer follow-up times.
Yes, longer follow-up and maybe even targeting populations we know are at higher risk for cognitive decline.
Is research like that happening?
It is. There are ongoing studies looking at both GLP-1 RAs and SGLT2 inhibitors, specifically in people with early Alzheimer's or mild cognitive impairment, or those with significant vascular risk factors. So, more data is coming.
Good to know. So let's end with that provocative thought for our listeners. Given this current evidence, particularly the signal with GLP-1s, what might this mean clinically?
Well, it's something to consider, isn't it? For neurologists managing patients with diabetes who might also seem to be on a path towards cognitive decline, how does this potential, though still preliminary, finding about GLP-1s factor into thinking about their diabetes management?
Always keeping in mind the limitations we discussed, of course.
Absolutely. It's not definitive proof by any means, but it's a piece of emerging evidence to be aware of as we await more robust data from future trials. Food for thought.
Indeed. A complex area where neurology and endocrinology intersect. Thanks for breaking that down.
My pleasure.